the most talked about issues here in New Hampshire nationally. That's health care reform. You voted in favor of health care reform, the new law. Why?
You know, health care is something that I've been working on for a very long time. When I was governor, I was really proud to be able to bring children's health insurance to New Hampshire. I understand and have talked to so many people who say, you know, I can't be secure about my future if I'm worried that I can't see a doctor when I need to see one, or families who say, you know, I'm worried that I can't afford to take my kids to the doctor. So I think it's very important for us to address making sure that people can see a doctor when they need to. But health care is not just about access. It's also about quality, and it's about cost. We need to begin to stabilize health care costs. Health care has become unaffordable for too many families and businesses who can't afford to continue to pay their health insurance premiums as they go up, in many cases, by double digits. So this is an issue that I have thought for a very long time we needed to address. And there's been a lot of misinformation, and we had, when we're talking about 1/6 of our economy, which is what health care is, it's easy to see why people are confused about what's in the bill. But there are some very good things that I think people will find are going to be very helpful to them. First of all, are health insurance reforms. You know, right now people are concerned if they've got a pre-existing condition. Well, they won't need to be anymore under this legislation. If you have a pre-existing condition, you can no longer be denied health insurance coverage. And for children, that begins this year with the passage of the bill. For people who are on Medicare, who have been concerned about the high cost of prescription drugs, especially those who fall into what's called the donut hole, where Medicare doesn't cover their cost of prescription drugs, they're going to get some additional help. Some of that will, again, begin this year, and eventually it will cover all of the cost of prescription drugs for people on Medicare. For small businesses who have had trouble covering their employees but would like to, but because of the high cost of health insurance, they haven't been able to do that. They'll get help with tax credits. So there are a lot of things in this legislation that are going to make a difference for people.
There are a lot of perceptions out there about this bill that is now law, and one of them is that it may burden cash-strapped states by bringing in a slew of additional health care costs. True or not?
Well, in fact, the analysis that the administration has done, Governor Lynch and his administration, shows that it will be cost neutral. And in fact, in the short term, they think it will provide some additional help to New Hampshire.
Just a quick follow-up before we go to a question on insurance. If it's such a good bill and law, what's fueling some of the groups that are protesting, not just this, but why is this added to either a suspicion or a disdain towards Congress and the federal government? This law seems to have added people rallying and protesting. Why do you think that is?
Well, I think there are a couple of reasons. Sadly, I think the legislation became very partisan, even though as it was going through the committee, there were a lot of Republican amendments that were adopted in the legislation. In the Health, Education, Labor, and Pensions Committee alone, they adopted over 160 Republican amendments. So I think when a bill is this big, when it deals with an issue this personal, there's confusion, there was a lot of misinformation about it, and that made it hard for people to understand what was in it. But I think as people learn more about what's in the bill, as they begin to see it make a difference in their own lives, that they're going to change their view of it. You know, the other thing, Jack, is that there was a lot of concern about the cost of this legislation, but in fact it's fully paid for, and the Congressional Budget Office, which is a nonpartisan agency of the government that talks about how much things cost, they have said that in the first 10 years it will actually reduce the deficit by over $130 billion.
So you think over time those who are upset will simmer down?
Well, you know, some people are always going to be concerned, but I think for many people who have been concerned about the impact, they're going to see that it actually is going to make a positive difference in their